Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. Everyone, thanks so much for the feedback on the previous video. It was really cool to put together. The message is really clear. It's great that it's getting to where it needs to get to, and that's men getting yourselves checked. Now you have a little bit more information. Today what we're going to do is a little bit different, but picking up on the prostatitis side of things. I just got a little bit of research, because you know that I like to back up everything with research when I'm talking to you about the treatments. So let's just talk about a little bit more in detail on the do's and don'ts, and also what to expect in the clinic when you're getting treatment for prostatitis in the acupuncture and Chinese medicine clinic. So first of all, always seek help from your physician. If you're not sure, if you think that from the symptoms we talked about before, if you're not sure, this is not for diagnostic purposes, so I'm only going to go through the do's and don'ts, but we take it that if you notice that something is not right, please get to your GP, get to your urologist, and make sure that you get things checked, okay? Don't take anything for granted, ever, okay? So first of all, I suppose the question would be, you've been diagnosed, and as you know, we talked about it before, there's a few different types of prostatitis. So if it's bacterial, then the focus from the acupuncture and Chinese medicine treatment will be a little bit kind of split between, obviously if there's pain, we're going to have to go and address that, because that will be the one thing that will be really uncomfortable for you. If it's bacterial, then obviously we need to help with the immune system side of things too. Okay, so that's pretty self-explanatory. Always, there's one of the things about Chinese medicine, always treat the excess. So if there's pain there, we're going to have to address that. In terms of helping with the immune system, that will be then to fend off that bacteria that is there, and that's a separate thing from the pain itself. So you would be asking things straight away about, whoa, hang on a minute, where are the needles inserted? Because I heard that acupuncture involves the insertion of small fine needles, and yes, it's true, we talked about it before, but I'll just briefly go through it here now. The needle sensation feels like, you know, the skin being pinched or a few hairs being plucked at the same time. Okay, so where the needles inserted? Normally speaking, the points, and from my experience in the clinic as well, lower back, it's very important points on the lower back, so a lot of work on the lower back, and then it depends then on the type of prostatitis, but lower legs, probably there, more than likely there will be a few points of needle in the lower legs, some of the arms as well, and then it depends, maybe some of the arms, and then, you know, front, maybe chest and intestine and stomach area. Okay, again, if you think about the bacterial one, I'm just thinking off the top of my head here, if you're thinking about the bacterial one, and if you were taking antibiotics, we are going to have to pay a little bit of attention to the stomach and the intestines. So, you know, something like that might complement the treatment, whereas there's specific points because of the pain and the more local areas, so the lower back, but not necessarily just at the you know, looking at the pain scenario only, because there could be other things alongside your own condition that might need a little bit of care. Okay, so in terms of the studies that I put together, and I'll try to have as much of the writing on screen as well, so that you can see what I'm looking at and what I'm reading as well. So as I said, the first one is from 2008, and the title is simply Acupuncture versus Sham Acupuncture for Chronic Prostatitis or Chronic Pelvic Pain. And I can tell you, for example, in terms of the follow-up, that after 10 weeks of treatment, acupuncture proved almost twice as likely as sham to improve CPPS symptoms. Participants receiving acupuncture were 2.4-fold more likely to experience long-term benefit than participants receiving sham acupuncture. So there was a clear difference between the ones that were actually getting the point needled through and stimulated, or the points in this case, and the ones that the point was just being touched. So again, without going into too many details, the methods were quite okay in terms of comparing the two of them. So I know that normally I wouldn't like to be talking about acupuncture versus sham acupuncture, but they kind of cover themselves really well with the way that they work this one out, and you can see the results then on the long term as well. So that was a good one. So the other one that I have to talk about is from 2014, and it's called Acupuncture and Immune Function in Chronic Prostatitis or Chronic Pelvic Pain Syndrome, and it's a randomized control study. So the reason why I actually included this one, now that I'm looking at it, it's because it includes the immune function as well. So in terms of talking about the prostatitis, that it's from a bacterial cause, I just wanted to give you an idea that it's not just because of the pain, but actually on that bacterial one, there's actually evidence out there of the success of acupuncture treatment. And as you can see, the objective is there on the screen. I'm not going to read through the whole thing. And what they did with this one was actually investigating 12 patients that were participating in a prospective randomized clinical trial comparing acupuncture versus sham acupuncture for effects on cellular immunity. So, and because it involved blood samples, you can really, and again with a follow-up, because it goes on to following up from the previous study, blood samples don't lie. Okay, like blood samples don't lie. If the information is there and if the details are there, it's going to show on the blood sample. So that was pretty good. I think I made a note here that again I'll put it on screen so that you can see, but the highlights from this study, and the levels of natural killer cells were significantly higher in acupuncture patients. So that's quite promising. So it does warrant more investigation. Another one that I picked up, I think that the next ones are all linked up, so I'm just going to quickly go through them and just say to you that they were all by the same group of researchers. They were in China. They were in the China Academy of Chinese Medical Sciences in Beijing and the Beijing University of Chinese Medicine that Siobhan and I had the pleasure of visiting before. So it's pretty cool to read and to look at actually research coming from there. And you can see that one of them states that overall rank tests and safety analysis indicate that electroacupuncture and acupuncture may be recommended for the treatment of CP/CPPS. That was from 2016. The same group of researchers actually worked on putting together a systematic review, and they have a study protocol that dates from November 2016, so I'm really looking forward to see the results from that one. But from the systematic review that they put together, their aim was to assess the effects and safety of the use of acupuncture for the treatment of chronic prostatitis. And let's just see, I think that I have, again I'll put it on the screen there, but the just reading from the conclusion, the evidence supported acupuncture as an effective treatment to improve symptoms of CP/CPPS. And what was really good about the reading the systematic review was because there was that comparison between acupuncture, electroacupuncture, and actually the other Western medical drugs as well. With regard to urinary symptoms and quality of life, there is no significant difference between acupuncture and conventional Western medicine. But what they found was that compared with conventional Western medicine, acupuncture may be more effective in decreasing the total scores. And what you see there, that abbreviation, that's actually a form that the patient fills in, and then you can get a score from that. So in addition, the use of acupuncture as an appropriate adjunctive treatment for symptom control in patients with CP/CPPS should be considered. So that's good results from the systematic review. So that is out there. You know that there's plenty you can do. The main thing, and I have it in big red capital letters there on the top, is stress does not help at all. Diet and lifestyle, we talked about it in the previous video. It's a big thing. Okay, so please make sure that you get that to the best that it can be. Okay, I know it's not easy and it sounds like the cliche talking about stress, but whatever you can do to reduce the stress. We talked about the muse here before, getting some help for in terms of meditation, calming things down, light exercise as well. Things like, for example, avoiding squats, that's not going to be a good idea. Even cycling as well, it's going to put more pressure in the area. Avoid sitting for a long period of times as well. Okay, so there's gentle exercise, there's relaxation methods, there's tools out there to help you, like the Muse, for example, in terms of meditation. Things to avoid, anything that you can think that will exacerbate inflammation. Inflammation is a big no-no. So if you think about it, there's already inflammation of the prostate gland. That's what prostatitis is. So you really want to make sure that, first of all, you're not adding to it. And then other things that you can take out of it will be next. But definitely hot, spicy foods. So we talked about the alcohol and being a big no-no. We talked about the coffee not helping at all. Dairy doesn't really help. Even things, for example, like with chocolate. Yeah, okay, dark chocolate, small amounts, that's okay-ish, but definitely, just being really careful with sugars. Okay, sugars are going to be a big, huge no-no as well. Okay, then you have other things to avoid: acidic foods and acidic drinks. Tomatoes, for example, you can think about how acidic they are. Wheat, gluten. Just be really careful with those, and particularly then I can't mention this enough: sugars. Be careful with sugars, alcohol, coffee. Inflammatory foods are a big no-no. Okay, so I hope that was a little bit of advice that will help you out. As I said, if you have any particular questions, get in touch. If you have any questions at all about your symptoms, and if you're not sure, please get yourself checked. Send us your questions. If you want us to talk in more detail about anything that we mentioned here, do as other people have done before. Just leave the comment below, send us a message, and we'll try our best to address all your questions. Okay, until next time, be kind and be healthy.
Oh, baloney. The whole thing always gets back to drugs.